want to start, though, if I may, with something a little bit more personal for you and your family that you revealed yesterday in the House of Commons. I want to just play it to our viewers who may not have seen this yet.
We talk a lot of the outbreak in Liverpool and how that great city has had a terrible outbreak and got it under control. This means more to me than I can say, because last month my step-grandfather, Derek, caught COVID there, and on the 18th of November, he died. In my family, as in so many others, we've lost a loving husband, a father, a grandfather to this awful disease. So from the bottom of my heart, I want to say thank you to everyone in Liverpool for getting this awful virus under control. It's down by 4/5 in Liverpool. That's what we can do if we work together in a spirit of common humanity. We've got to beat this, Madam Deputy Speaker. We've got to beat it together.
I was very moved by that, Health Secretary, and I want to send, on behalf of everyone here, our deepest condolences to you and to your family. Tell us about your step-grandfather, Derek.
Well, Derek was my stepsister's stepfather. I have a complicated, messy and loving family, and we're one big extended family, really. He sadly, he caught coronavirus in November, and then he passed away, and it's just awful. He was in his 70s, and it just shows how important it is that we keep this thing under control. And it shows to everybody how important it is that we can get through it. The irony was that Liverpool, thankfully, has really got this under control. But in that period when the infection was going round, he caught it and he died, and it shows that it can affect all of us.
Your emotion was very obvious there when you were speaking yesterday. It looked like you were close to tears, understandably. It's obviously been a big blow to your family to have personal first-hand experience. You will know this has been replicated tragically all over the country. Nearly 60,000 official deaths now recorded from this. Given what your family has now gone through, has it given you a new perspective about this virus?
Well, it's made me really, really determined, Piers. And I understand when people say that there are big consequences of the decisions that we've taken to keep the virus under control. And I know that. And, I also come from a small business background. I understand the impact on businesses. But, we've got to do that. And especially now with this vaccine news, we can get through this together as a country if we do the things that we all know we need to do. And it's just made me even more determined to get this thing beaten. Well, I just really feel it here. Yeah,
and that was very clear from what you said. And actually, I love the fact that this morning you've described your family as complicated, messy and loving, because I think that is a reflection of so many families across the UK. And we're very sorry for your loss, obviously, and I'm sure it will affect you very deeply and perhaps change your perspective on what has happened. Let's talk about the vaccine, because it is a good day in terms of progress. How come we have become the first to approve this vaccine? Because we're way ahead of Europe and the United States.
Yes. Well, it's partly down to the brilliant work of the team, the Business Secretary Alok Sharma, Kate Bingham and the Vaccines Task Force in terms of buying and getting access to the vaccine. And it's also down to the MHRA being a brilliant regulator. We don't often praise regulators when we talk about these sorts of things. But what they've done is they're rigorous in the safety checks. But instead of applying those safety checks one at a time, one after the other, they've done them in parallel. And by doing that and working closely with the company so that they've seen the data coming in from this the clinical trial as it was going on, they've been in a position to be able to make this to make this authorization
You
now.
do
so it
have
means that people can start having this life-saving vaccine next week.
From next week. But you do have a job on your hands, don't you? From people who say, on the one hand, you've got the people who are anti-vax. Let's just put those to one side. You do have a significant group of people who think, this has happened too quickly for my liking. How are you going to persuade people to take this vaccine up? Because unless most of us have the vaccine, it's not going to have the effect in terms of getting rid of other restrictions that you want it to.
That's right. And you know, the vaccine wouldn't be approved by the regulator if it wasn't clinically safe. But also what I'd say is don't listen to me. Listen to the clinicians. Listen to the experts. People like Professor Jonathan Van Tam, JVT as he's become known. Right? He is an expert in these things, and he's said that he's called his mum and said, "Mum, if you get the call from the NHS, make sure you get there and get vaccinated." Because as I know only too well, and so many families know, this is a deadly disease, and the vaccine protects you from it. The other thing that I'd say is that what I'm really pleased about is that the proportion of people in this country who are happy to have the vaccine is actually increasing at the moment. We track this really carefully. And when you compare the UK to other countries around the world, we're one of the top in the world in terms of the proportion of people who are willing to take the vaccine. So
we were talking about this earlier.
Vigilant, and there are.
I was saying we would happily take this if it helped get the message over. I'd take it live on air. I don't care. I mean, I just feel like it's really important if we're going to get through this that enough people take it.
Yeah, I'll take it with you, Piers.
Well, you know what? Let's do this. Actually, I'm serious.
I think you've got to show leadership in these things.
I'll come to where you are anytime next week if we can do this, and let's do it together, live on air. It would be powerful. It would send the right message. If you take it, I take it, Susanna takes it, Dr. Hillary takes it, I think it will have an impact.
Well, we'd have to get that approved because, of course, there is a prioritisation according to clinical need, and thankfully, as a healthy middle-aged man, you're not at the top of the prioritisation. But if we can get that approved, and if people think that's reasonable, then I'm up for doing that. Because once the MHRA has approved a vaccine, they only do that if it is safe, so. If that can help anybody else, persuade anybody else that they should take the vaccine, then I think it's worth it.
I would only take it for one reason, not self-interest because I want to be protected, although I'd love to when my time comes. I would take it to show people that it is safe. That's the point of doing it.
And can I just, Matt Hancock, you have already had COVID.
Yeah, exactly.
So why would you then have the vaccine?
Because we don't yet know the impact of having had COVID on whether you're both immune or don't transmit it again. And so we'll be vaccinating people whether or not they've had COVID. So that's one of the things that that has been looked into by the scientists, and they think that we should just vaccinate people whether or not they've had the disease.
There's huge pressure on you now.
In the same way that the Prime Minister has had to...
There's huge pressure on you now. I mean, it has been all year. And you and I have locked horns many times about the way you've done certain things. But this is, in many ways, the biggest test, isn't it? It's clear that if we can roll this out in enough numbers fast enough and get enough people vaccinated, it's not just, as our correspondent said earlier, the light at the end of a tunnel. It's coming out of the tunnel.
Yeah, it is. Yeah, I've described it as it's the dawn that's on the horizon, because it's not just it's lifting all of the gloom once we can get it rolled out. And I have great faith in the NHS across all 4 nations to deliver this. This is a UK vaccine. It's been a UK procurement. It shows actually why we're a stronger country, all united together. And then it'll be delivered by the NHS. The armed services are also helping, and they're supporting on the logistics and doing a great job, but primarily delivered by the NHS. So obviously we've been doing a huge amount of work and getting ready should this moment arise.
And where are we? Where are we on the other two?
Way. We're nearly there.
Okay, the other two vaccines quickly. The Moderna vaccine is only being manufactured, I understand it, for delivery in April, and we have 70 million doses of that on order. The AstraZeneca vaccine, the Oxford one, we're about to hear how quickly that may come to availability, but we have 100 million doses of that, and it doesn't require the extremely low temperatures of the Pfizer one. You know, could there be even better news coming quite quickly that this Oxford one in particular, with the massive order that we have, could come fast as well before Christmas? Yeah.
Well, let's hope so. I mean, we're on the Moderna one, we've only got 7 million doses, and as you say, it's only being manufactured for delivery in April. The other early one is the Oxford AstraZeneca one. As you say, it doesn't require the -70, which makes it much easier to roll out, especially out into the community, people who can't travel to a hospital or to a vaccination centre. So it is logistically and operationally easier. That's currently with the MHRA. And having done their work on the Pfizer one, they're also working in parallel on the Oxford AstraZeneca one.